Hey, I'm Will Martin. I'm going to see if I can articulate my irritation without rambling too much. So I'm going to give it a try. But masking has bothered me since day one. It may have bothered you since day one of the pandemic. It may not have. I don't know. I did believe in the beginning that it was probably wise to follow the recommendations and wear a mask and wear an N95. I have a 94-year-old mother. I don't want to bring viruses home to her. And so I was as cautious as anyone in the beginning. And as time went on and as some evidence came out, I started to become a little more skeptical about the value of surgical masks in particular. N95s may have a little bit more value, but the surgical mask has been an issue for me since very early on. And I'll tell you why. It's not just the discomfort of wearing the mask, but a study that I found from China very early on in the pandemic suggested that the melt blown plastic mask, which is the surgical mask that we wear, they're plastic. And on a microscopic level, there are little microparticles, and we're talking about nanoparticles of plastics that are loose to begin with, but once you wear that mask for a period of time, they become more loose. And what are you going to do? You're going to inhale those nanoparticles of plastic. And where are they going to go? If they're small enough, they're going to go right down into your alveoli. Now, can I prove it? No. Have I done a study on it? No. But do I have some common sense? Yes. I think it's worthwhile to study this in a little more detail, but it hasn't been done, and it probably won't be done. As a matter of fact, the only studies that I've ever found regarding masks was the effect of masks on the environment once we discarded them. And in particular, if you look in the literature, you'll find tons of literature about masks that wind up in ponds and streams and lakes, and how those masks are affecting waterfowl and fish, in particular because of the plastics. So if the plastics are affecting waterfowl, fish, birds, whatever, what about the wearer that was wearing the mask prior to discarding it in said river, lake, stream, or pond? That's my point, is that these masks are not a non-zero threat. How much of a threat are they? We don't know, because it hasn't been studied. It hasn't been studied. The only thing that's been studied is the effectiveness of wearing a mask on prevention of contracting a virus or spreading a virus. And none of these studies are great studies to begin with. But the Cochrane collaboration, the Cochrane Library, did publish on January 30th of this year a Cochrane review, which is entitled Physical Interventions to Interrupt or Reduce the Spread of Respiratory Viruses. Essentially, physical interventions like hand washing and mask wearing. And does that interrupt or reduce the spread of COVID or flu or any other virus? And I'm going to share this with you. Let me get my screen shared over here. So let's go down to the author's conclusions, okay? And the author's conclusions say the high risk of bias in the trials, and they're talking about the multiple trials that were reviewed in this Cochrane review. The high risk of bias in the trials, variation in outcome measurement, and relatively low adherence with the interventions during the studies hampers drawing firm conclusions. There were additional RCTs during the pandemic related to physical interventions, but a relative paucity given the importance of the question of masking and its relative effectiveness and the concomitant measures of mask adherence, which would be highly relevant to the measurement of effectiveness, especially in the elderly and in young children. In other words, if people aren't wearing them, or if they're wearing them down under their nose, then they're probably not effective. Even if they were effective, they would be ineffective by improper wearing. And talking about kids, we've seen kids. We've seen the 2-year-olds with the mask over their face, and that mask isn't going to stay on their face. But on top of that, what's it doing to the kid? What's it doing? I mean, if there's a clear, obvious benefit to wearing that mask, then you have to do what you have to do. But it's not been shown. It's not been shown. Anyway, the author's conclusions go on to say there is uncertainty about the effects of face masks. The low to moderate certainty of evidence means our confidence in the effect estimate is limited, and that the true effect may be different from the observed estimate of the effect. The pooled results of randomized controlled trials did not show a clear reduction in respiratory viral infection with the use of medical surgical masks. There were no clear differences between the use of medical surgical masks compared to N95, P2 respirators in healthcare workers when used in routine care to reduce respiratory viral infection. Hand hygiene is likely to modestly reduce the burden of respiratory illness, and although this effect was also present when influenza-like illness and laboratory-confirmed influenza were analyzed separately, it was not found to be a significant difference for the latter two outcomes. Harms associated with physical interventions were under-investigated. And that's the point that I'm making, well, making several points, but the point that has bothered me is harms associated with mask wearing were under-investigated. I mean, I think they haven't been investigated at all. I mean, nothing that I've found. We've just investigated the results of masks when you drop the mask in a parking lot at Walmart and a bird picks it up and flies off with it and winds up getting plastic ingested in its system, or breathes in nanoparticles of plastic or whatever. Never mind about the wearer that was wearing it before. Ultimately, it says there's a need for large, well-designed RCTs addressing the effectiveness of many of these interventions in multiple settings and populations, as well as the impact of adherence on effectiveness, especially in those most at risk. So the bottom line is, in a Cochrane review, they take all these trials and they bring them all together and they try to make some sort of sense out of all of them. They try to boil it down to ultimately what are these trials saying. Now, again, none of these trials were great. There's so many variables involved in doing a trial on masking. You know, you have people that are really into masking. You have people that are resistant to masking. You have people that believe they're sick even when they're not sick. You have people that have no fear of getting sick. I mean, you just have just tons and tons of variables. And so it's difficult to take all of these studies that have been done so far and make a lot of sense of it. But the Cochrane Review has tried to do that. And ultimately what they found is that there is no benefit to wearing masks. So this gets to my point that as of today, New York State, probably one of the last states that I'm aware of that still had mask mandates in healthcare settings, was lifting that mandate. However, every county in a metropolitan area of New York State has decided to continue the masking. In my county, in particular, and at my hospital, which kind of leads the way in decision making, they have said that the wastewater levels of COVID-19 are still high, and the death rate is still high, and on and on and on. And it just makes you wonder, is there an endpoint to this? Is it that they're afraid to be the one, to be the person, to say, okay, we're not going to wear masks anymore? I think there really is a fear. No one wants to be that one person in leadership to say, okay, we're going to stop it. There's no evidence that shows that this is of any benefit anymore. When you leave the hospital, or for that matter, when you leave a patient care area and you go to the cafeteria, whatever, you're not wearing a mask. But when you leave the hospital, when you go to the grocery store, when you go to the mall, when you go anywhere, no one's wearing masks unless they want to. And as far as I'm concerned, if you want to wear a mask, wear a mask. If that's what you want to do, if it makes you feel better, then you should have the right to do that. And you do have the right to do that. But for me, I can't see my patient's face. They can't see mine. Now, I've practiced over 3 decades, and I can say that looking at a patient's facial expression and them looking at mine is meaningful. To say otherwise is stupid. But we've just ignored all of that. It just doesn't even matter anymore. It just doesn't even matter. You just wear your mask and that's it. The fact of the matter is, if you were coming to work with me and you are anywhere other than inside a patient room, your mask is down under your chin. That's me, but it's also almost everyone that I'm working with. So I think there's already rebellion, and yet, by the same token, we don't want to go in a patient room and offend a patient by having our mask down. I mean, this is the craziness that we've gotten to, is that we don't want to walk, and I'm included in this. We don't want to walk into a patient room and offend somebody by having my mask down, because I don't know what their feelings are on masks. We've done a very poor job of studying this issue, implementing it, and obviously determining when the time has come to say enough is enough. It is clear that, well, it's not clear, but it's suggested that if anything might be effective, it's hand washing. Just basic hand washing, like it's always been. And what's frustrating to me, I've practiced through pandemics, other pandemics. Yes, we've had other pandemics. We've had swine flu and we've had other pandemics that were significant and did result in loss of life. And yet there was zero requirement to wear a mask, gowns, gloves, face shields, 6 feet of separation, social distancing, all of these catchphrases that we've come up with now. It just makes you wonder, is this just a desire to not let go of power? I don't know. Our new county health commissioner, who is a physician that practices at my hospital, I don't think is a person that has some desire to have power. But then again, I don't know. Like I said, maybe these people are just afraid to be the ones to say, okay, folks, enough is enough. It's time to stop. And it's time to kind of take a step back and think about what we've done over the last 2 years, what really worked, what didn't work, and what might be done in the future. Because there'll probably be another one of these pandemics coming up sometime soon. So I had to make the video because, I'm frustrated. Like I'm sure a lot of you are frustrated. And I think that it's really something that we need to talk about, but have been afraid to talk about up until now. And even now, maybe we shouldn't be talking about this. I don't know. But I want to be able to see my patient's face. I want them to see mine. I think that alone is enough reason to say, let's stop this and let's get back to normal patient care. I'll leave it at that for now. I hope you enjoyed listening to my rant, and I would love to hear your thoughts. Am I right? Am I wrong? I don't know. Let's hear what you have to say. Until next time, take care, and I'll talk to you soon.